All right, let's get started. So welcome everyone. Thank you so much for joining. My name's Amber. I'm the president of AAPI Montclair. Thanks for coming to this workshop on finding a mental health provider with Sweta Kansagra, LCSW. Thank you for investing the time tonight and learning more about this very important topic. Even though 15% of AAPI is reported struggling with mental health in the past year, we are also the racial group that is least likely to seek mental health services. And by just the simple act of showing up for or listening to this workshop, you are helping to fight the stigma around discussing mental health and building knowledge that could be valuable to you or a loved one now or in the future. So just some housekeeping notes. We are recording this to post on our website later. It's set up as a webinar, so your name will not be revealed, but you will have the opportunity to drop questions into the chat or to unmute yourselves to talk with Sweta. We will also have, you can ask questions at any point. We'll also have a Q&A session after Sweta is done with her initial presentation, and we'll share some resources at the end. We are deeply grateful to Sweta Kansagra for gifting us her time and expertise tonight. She is a licensed clinical social worker with a private practice in Montclair. She has been in private practice for over 5 years and in the field of mental health for 10 years in direct client services. She is passionate about learning, growing, and sharing information with others through the work she does. Her practice areas of focus are perinatal mental health, couples therapy, and hypnotherapy. Currently, Sweta is expanding into group practice with the intention to bring in more clinicians of color to create greater access to care and information for those in the BIPOC community. Sweta, over to you.
Awesome. Thank you, Amber, and thank you to everyone who's here tonight. I'm gonna kind of jump in on what we're doing here. We were fortunate to be able to offer this workshop in person a month or two ago, and we saw a lot of, I think, enthusiasm and interest and curiosity about how to delve into the world of mental health. So today is going to be very informational, very open. I know that I am not able to directly see you, but if you have any questions, I think there might be a chat box, or you can always let Amber know, and we're going to be able to hear those questions from you. My intention is to kind of start this as just discussing what therapy is, what's the difference between talking to your friends and seeking advice versus what therapy is. So just to kind of say to everyone here, I have heard this statement many a times as a therapist, especially by those who I know personally, who will say to me, I don't need to go see anyone. I already know kind of what my concerns are, what my barriers are, and I have a really great support system, so I can just talk to them. And yes, you absolutely can. They are probably people who will make themselves accessible to you when they can and listen with the ear that they have to offer. However, the reality is most likely without intention, they're going to provide you with advice that may or may not meet you where you are. The difference in therapy is that it's really more of a process to help you sit with what is coming up for you in that moment. You may or may not have words for it. Oftentimes the therapist is going to help direct that space for you, kind of create a reflective space in the room and really sit with you where you are in that moment. I kind of say to everyone who comes into therapy, I might get that first call from you and you might say X, Y, or Z is going on. In that first session, you might come in and find yourself really connecting to a different part of yourself. And that's what space can do for us. It can really offer us the space to really say, wow, I didn't even realize this was coming up for me. And not only has it been coming up for me, in terms of I'm having trouble sleeping at night, or I'm noticing that I'm feeling a little bit more irritable with the people around me. But I'm just really kind of having trouble finding that movement for myself. And so therapy is really that space where you come in for the first time and you go, oh, I'm feeling some level of relief. Just having someone who works in the field see it, name it, identify it, and tell me, hey, there's a roadmap ahead of us that we can use to work with what's coming up for you. Now, we know that in the AAPI community, it's not often that our friends or family members will say to us, hey, maybe you should go talk to someone. Because as Amber said earlier, it's the community that's least likely to actually seek out the services. So there is no doubt that I, with intention, have found myself in this field because I'm someone in the community who's quite aware that a lot of people in this community do not believe that therapy is really a tool to work through what's coming up. A lot of times it's, you have to be strong, or you have to keep it to yourself, or we don't need that help. We don't share what's going on in our family. We keep it to ourselves and we don't make a big deal out of it, or it's not as bad as there's a lot of comparative suffering that we can talk about. So when I'm talking about therapy tonight, what I'm saying is that if you are recognizing something is coming up for you or a loved one, and it's not within your scope to be able to really help them and guide them through it, that's where a therapist can really come in and not only provide tools for that person, but also for those loved ones around them to really say, hey, this is the best way for that person to be supported. I'm going to kind of continue on and go into the next section, which is talking about realizing I need a therapist. So now, where do I start? Where do I go? Sweta, I'm here tonight. Obviously, I'm interested enough to know what the next step can look like. Can you tell me what I would do next? Sure, absolutely. But there's always questions that you need to ask yourself before you're looking for that therapist. And these are kind of some of my starting points that I say to anyone who outreaches to me, whether personal or professional. Do I want to stay in network, or am I okay with going out of network? What are the differences? And it's a pretty big deal because cost is involved. So if I want to go in network, what I'm saying is that I'm only going to see a therapist that takes my insurance. How do I find that person? I have options. I can go onto my insurance website. I can see who's listed on there. I can go on to Psychology Today. I can see who's listed on there. I can even click it by my insurance, by what their specialties are, where they're located. Do they provide telehealth or in person or both? And then I can really start to parse out who's available in this insurance plan for me that I'm interested in talking to. I will say this, and I'm going to be really transparent in acknowledging this. Not a lot of providers that I have been able to find myself included, who are part of the AAPI community and working in mental health, are actually in-network providers. So oftentimes what I find is in-network providers are usually part of a group practice. And part of the reason for that is group practices are generally able to take insurance due to the volume of business that they are doing. A lot of private practice providers, due to being kind of a sole provider, tend to not be able to take insurance or are just not paneled for their own reasons. And therefore, they are out-of-network providers. What is an out-of-network provider? That means that we don't take insurance, that we will typically give you a super bill. A super bill has your insurance information, our information as a provider, and your diagnosis that we will list for you on there. And that is something that you could submit to your insurance company, and your insurance company will then provide you with reimbursement based on the percentage that you are allotted back on your out-of-network plan. We really leave it up to everybody to kind of check that on your own. So I highly encourage, when you're starting this process, even though it is for a really important personal reason, to know whether or not you're willing to go in network or out of network, and to do your homework on what that's going to cost you. Because I always say, if you're coming in and you're dealing with a stressor, we don't want to add a financial stressor to your list of things to think about. So it's just much better if you think about that before you start making those calls, because you might connect with a provider who doesn't take insurance or doesn't take your insurance, and you might be really disappointed because you wanted to work with them. So it's just good to kind of get that out of the way before you even start making those phone calls. So the next thing I always kind of say is think about, is gender important to me? For some people, it's an extremely important factor. For some people, it doesn't matter at all. If it does matter, it really starts to be something that, again, you're going to be able to parse through on those listservs that I mentioned earlier, and Amber will be able to share a resource guide with those lists as well. There's also an out-of-network guide, which is kind of how to call your insurance company on there as well, and ask all the questions you need to ask about seeing whether or not you have these mental health benefits in an out-of-network form. Is race and ethnicity important to me? And so those questions can come up because we might say, and part of this call is on the AAPI group, is we might say, I really want someone that I feel like can identify with me, or that I look at in the room and I feel some connection to, and I feel some level of identification with. If that is the case, then again, you're going to be able to get much closer. It's almost like you're making a bullet list of what are your desires or ideal must-haves in the room before you walk in that room the first time. And specialties, right? We might be going in for something really specific. I myself am trained in couples therapy, perinatal mental health, and hypnotherapy. So those are my areas of specialty. So they tend to be the clients that I see the most, and I have a pretty well-versed knowledge base and idea on how to support them. It could, if you're coming in for something that's trauma-based or directly correlated to something health-related or is for your child, it's really important that you have somebody who actually specializes in that arena and can say, yes, that is something that I understand well, I can guide you through, and I have the resources and tools to do so. So I would really, encourage you to really think about, am I looking for something specific, or am I looking more for a garden, variety therapist who has the ability to kind of work with all different areas? Anxiety and depression are kind of those two areas that most therapists will always be able to work with on a baseline level. It's when we're looking at it connected to something really specific that you might need a specialization, and that therapist can guide you on whether or not that's an area that they feel well versed in. And if they can't, most therapists are really good about saying, hey, I might not be able to do that, but I'm really happy to look into my community and find someone that can for you. So I've got these questions answered. I kind of made my list of things that I know I'm looking for. Now, where do I start looking, right? And those are some of the places that I mentioned earlier. That's the Psychology Today, that's the ZocDoc. I know that on our local Facebook page, I've seen people post for therapists on there. It's also a great resource to look. The AAPI group, we're going to be actually creating a resource page for that. I know Amber already kind of has it ready to go. So there's a whole resource of therapists on there that work within the community. There's also some resources for kind of lower fee services or community clinics that can also be more accessible. So we're really creating as much access to care as possible. I want to say this with the asterisk that, like anything else, you might make a few phone calls before you find that person that's a right fit. And I can imagine that when things feel really hard or really overwhelming, it's not always the work you want to delve into. I can really encourage you and say to you that when you start and when you sit in that room the first time, even sometimes just getting the appointment on the calendar can provide some relief. And so I highly encourage you, even if it means kind of engaging a family member or friend to help keep you accountable to do it. It's a huge step if you can, and if you kind of stick to that idea. If you today are saying, hey, I might need someone, or I know someone who might need someone, start this process right away, because you could be in an appointment as soon as next week and already, kind of sleep better tonight knowing that's a possibility for you. Do I prefer telehealth versus in person? That's a big question that's coming up right now. Prior to this pandemic, telehealth always kind of existed to a degree. It wasn't the preferred way to be with your therapist unless you kind of live in a remote area. Now telehealth is kind of part of our world, and a lot of clients, I definitely find for myself and a lot of my colleagues, are preferring to stay in the telehealth model, even though they might be down the street from my office. So I would really, want you to know, is telehealth okay for me? Do I prefer a hybrid option? And that might mean I need to make sure that this therapist that I'm seeing has in-person days or hours available. If you are okay with telehealth, you're kind of opening up your search to anywhere in New Jersey. So the nice thing about it is you're not limited to Essex County or our local area if you're someone local to this area. But of course, that also limits you from ever going to see that therapist in person if they're not local to us. But that being said, if you're, saying, nope, I definitely want the option to see the person in person, I want to develop a relationship with them, I don't have the privacy in my home, then absolutely stick to that for yourself. And there are many providers back in office, and you can absolutely find somebody who is. I myself am a therapist too. If I get a call and I can't take that person, or, for whatever reason we can't work together, I'll typically put it out there on my local listserv that therapists have access to and try to connect that client. So I really want to mention again, and I know I'm a little repetitive, but if you make that call after kind of checklisting all these things that that you want, most likely that therapist that you speak to that may or may not be able to work with you will also be able to help you get connected to a list of other therapists that might also have openings. So, just start with these lists of things that are your intentions and hopeful must-haves, and then kind of go from there. But I know the telehealth versus in-person conversation is a big one right now. And a longing for many people, I think, especially since we've been home for a while. So if you're finding that in person is a desire, there'll definitely be a therapist out there for you who can offer it to you. One of the other areas that I kind of want to talk about is specialties. Kids, adults, couples, all of these areas are ideally something that a therapist should be trained in. I say that to say sometimes clinicians will say, I can work with kids, adults, couples, and other areas of specialty. I really want to say that training for that is so important. And so, of course, it's great to work with somebody who has a general idea of most things, but you really want someone who can say, I work with kids. This is my area of specialty. These are the things that I understand about working with kids. So you know that this is really what they're focused on and where they're putting a lot of their energy and resources. Couples is the same thing. I'm someone who's worked with couples. I've done extensive training to do so. It's a juggle for sure in the work, and you don't want somebody who's kind of throwing their hat in the name or ring and saying, I think I can try it. You want someone who says, this is how I do it. This is the modality that I use. And I could share a little bit with you about what you can expect from it. So you really want that therapist kind of sitting in the driver's seat and letting you know how they work and what they intend to do in the room, so that you have an understanding of what your expectations should be. There are a couple, modalities that I'm going to quickly mention that can be talked about the most. There's CBT, which you might have heard before, cognitive behavior therapy. That therapy model is one that is very structured. You'll find that there's kind of homework in between. So if you're a client who likes something to kind of know that they can tangibly do from session to session, that model will probably speak to you. And it'll be something that you can kind of utilize going forward. It tends to be a shorter form of treatment, but it also tends to be very intentional. Solution focus tends to have something where you might come in with a really kind of specific problem that's coming up that that you feel like you kind of need an answer to and some guidance on. And that therapy model tends to be somewhat of like a 12-week model. And a lot of therapists will kind of say, you're coming in with this goal, we're going to work on it, and that's what we're going to stick to. Psychodynamic, which is what I'm more so trained in, is something that, we kind of meet you where you are, but we also try to understand more of the history, do a bit more unpacking in it. It's not really a short-term model. There's not a defined time frame to it, but as a therapist who's been working in it for, long enough now, I can say to you, it's definitely not forever. There's a lot of fluidity to it. At some point, the goals are met that you come in for. And then, as we know, situational stressors occur, and you might kind of come back in to check in about something else later. But there is, kind of a longer term treatment when you think about that psychodynamic model. When it comes to couples therapy, I just want to kind of mention two modalities that are really popular. They are the Gottman model. That one tends to have a bit more structure to it and kind of more guided work in it. And then there's emotionally focused therapy that's based on attachment theory. That is the one that I am trained in, and it's definitely got a little bit more of an open-ended work to it, with a lot of active involvement by your therapist in that model. Most therapists working with couples will say to you that they, need to speak to both partners and really ensure that there is safety in the space, both, emotional and physical, to move forward in this space and make sure that both couples can be engaged in it. I'm going to kind of take a quick pause here and check in with Amber, because I feel like I'm kind of just going on and on. The modality of the webinar is that experience. Amber, how are we doing? Because I'm kind of got a part 3, but I just want to check in and see if there's any questions before I move into it.
Yeah, I had a question about the sort of ranges that would be reasonable to expect when thinking about that in-network versus out-of-network question. If I could just very frankly ask you, like, what
Please.
pay? Yeah.
So when you're speaking about ranges, you're talking about ranges for in-network if you were to use your insurance, how much that would be? Yeah, if you were to use your insurance, it's your specialty copay, which I think most people's range anywhere from $20 to $50 on whatever your specialty copay is. If you're going out of network, this area, Essex County, tends to have what's called the usual and customary by insurance companies. So as an out-of-network provider, I stay within the range of what the usual and customary is. And so my session rate, and I'll be transparent about it, is $200. That tends to be a pretty standard rate in this area for insurance companies to be able to reimburse on as well. If you go well out of the usual and customary, a lot of insurance companies will still only reimburse you to what they consider the reasonable rate for this area. So a lot of therapists try to stay in that range, even as an out-of-network provider. However, I do want to acknowledge that it can, most therapists I know in this area are anywhere from $175 to about $295. For couples therapy, it can be a little bit more expensive. It can be somewhere closer to $250 to $350. If you're looking for psychiatry, which is medication management for for yourself, psychiatry ranges more in the out-of-network range, closer to usually $500 to $700 for an assessment, which is about 2 hours long by your psychiatrist. And then most check-in appointments, which are med management appointments, will typically be closer to that $400 range, with the reminder that your psychiatrist, you're probably not seeing as consistently. Most likely you're seeing them after that first appointment, anywhere from 1 month to 3 months apart. But once you're on a medication and you're stabilized on it, they typically move you to anywhere to a 3 to 6 month mark. So you might have a few appointments back to back, and then you're going to really start to separate from that point. So it can be a little expensive early on, but it really slows down. And the psychiatry, you can of course find an in-network provider. It's much harder. The wait lists for in-network psychiatrists are pretty long, and one thing I will say, there's a lot of great in-network psychiatrists. They tend to work closer to, a lot of hospital settings in their outpatient mental health centers. So those can be months long for a wait list. The only but downfall to that setting is that if you need something in between an appointment, it's really hard to get access to your doctor in between appointments. So that's the only true downfall that I've been told about in those settings. Whereas if your physician works in private practice in psychiatry, oftentimes if you reach out to them, if you're noticing a reaction to your medication, they're pretty quick to call you back because they're in private practice. So it's some big ranges. I want to add though, with the out of network, because I am talking about what the cost can look like. Since I'm an out of network provider myself, I can tell you that many of my clients, because I'm aware through them sharing this information to me, they get reimbursed depending on their insurance, anywhere from, I've seen 50 to 70% back. So while my rate might be what it is, they might be paying anywhere from $60 to $100 truly out of pocket per session. But the only difference is they're paying me up front and then waiting for that check from their insurance. So it's definitely something to consider. And that's why I always say check your out-of-network benefits, so you really know what you're signing up for. And the out-of-network benefit guide that we're going to provide, it gives you all of the questions to ask, so you know what you're asking your insurance company.
Thank you. That's really helpful context. I mean, I feel like there can be a reluctance to spending money on ourselves, and it feels a little
Absolutely.
indulgent. So when you hear a sticker price like $250 per session, it can be
Mhm.
really intimidating and sort of daunting.
Absolutely. It truly can be. And I really want to acknowledge, as someone in the field, that I also do agree with that, that initial kind of shock to the cost of it. However, I do want to say, that's why educating ourselves on what our benefits provide us is so important. I kind of said earlier, I'm someone who loves information. So I love to share with everyone that your benefits might cover much more than you actually realize they do. And so that sticker shock can actually come down much more when you realize you're getting that percentage back. And it might also give you access to care that you didn't realize that you had. That's not to say that there's not many amazing in-network providers. There absolutely are. I just want to say to that sometimes you may or may not get to pick who you work with in those group practices. So you might get assigned a therapist versus actually getting to choose your therapist. So there's just, there's benefits on both ends. What I want to say, though, wherever you make that first call, it's just amazing that you're making that first call, and you'll kind of figure out from there. I saw something pop up in the chat. Not just, absolutely. Thank you. So what was mentioned in the chat is that, there's also what's called an out-of-network deductible. And essentially what that is that you're going to have a deductible through your insurance company that you'll have to meet depending on what your insurance is. And you'll have to meet that deductible prior to them providing any reimbursement on that percentages that I was mentioning earlier. When you make that phone call, you'll know exactly what it is. And they'll tell you, once you meet this amount, you'll be able to then get the reimbursement percentage back. So they should explain that to you. But if they don't, whatever number they give to you, let's just say it's 1,000, and your sessions are 200 or 250, that means that you're not getting any of that percentage back until you pay that out-of-network deductible. So it's going to be that 1,000, and then you'll get your money back. All right, so you'll ask those questions, and they're all, again, in that guide that I provided. This is a little bit of education for yourself, and I know it's kind of that not exciting stuff, but I think it's important to know it so that you know how to get started, because this can be one of those things that just feels overwhelming before you even get in the door. So thank you for kind of throwing that out there about the deductible, because it is important. And as much as I don't want a talk about mental health to be about insurance, the reality is it can be, right? And this is a part of the process, and sometimes it's a part of the barrier. So it's important that we educate ourselves on how to understand it. Is there anything else, Amber, that you kind of feel from the initial area that I'm mentioning?
Yeah,
What to look for and where to look?
Yeah, I find it really helpful when you talked through some of the different vocabulary, like what CBT is, what solution-focused therapy is, and psychodynamic. How do we know what kind of style or mode we should be looking for what we're experiencing?
Yeah, that's such a great question. So I don't think you initially know what you're looking for until you try therapy. How I know, so I'll give you an example as the therapist, how I know whether or not I'm a good fit, because I'm a more psychodynamic focused therapist. If you were to call me and say to me, hey, I'm working on X, Y, and Z, this is something that I know I really want to focus on. I have, I feel like I can commit to this work for a short period of time, and I really just want to come in and focus on this. I'll say to you that makes a lot of sense. It sounds like you know exactly what you're in the work for right now, and this is what you want to talk about. I'm probably not the best fit because I'm not really trained in that modality, and it's not the one that I work the best with. But it sounds like you're looking for a solution focus, or it sounds like CBT would be absolutely great in what you want to stick to. I'm going to send you to Zoc, or I'll send you to ZocDoc, or I'll send you to Psychology Today. You can click on the CBT button and you'll be able to find a list of providers. And I also have a listserv. I'm happy to look on there for you and see if I can get you some names. So you might not know what you're looking for. What you might end up doing is going to Psychology Today, reading. So every therapist, we write our profiles on Psychology Today. If we list on there, we get to write it. It's all from our mouths. So I find that a lot of people who pick their therapist that way, doesn't mean it's the person you're going to work with. You read it and you say, wow, did that speak to me? Is that a person that I see myself wanting to set up a call with? That's kind of where you're going to start on your end. That therapist then will tell you whether or not they're the best fit for you and why they are or are not. And most likely they're going to give you a language for what you're looking for based on what you said to them. And so you just start with saying, let me read a couple profiles and let me see what I want right now. And you might click them by insurance or by, ethnicity, location. You might click on something like that. I know a lot of people find me because my listings are under perinatal health and couples. So those are kind of the two arenas that people find me through. And then might get led to me, and then I might guide them to someone else, but usually I will give them names at that point so they're not making 20 more phone calls. So do that, to start with. Even if you don't find your therapist on Psychology Today, I think Psychology Today is the best starting point because you get to read different therapist information, and it's so nice to see, what resonated with me and what didn't, and kind of guide you a little bit closer to who you want to work with.
Can I pick up on what you were saying about thinking through how important like the gender of your provider or the race and ethnicity of your provider is? Because I can imagine thinking it might mean something that possibly it won't actually mean, or vice versa, having more weight than one would have expected.
Mm-hmm. I want to sit with that for a moment, Amber. So when you're mentioning it, are you mentioning it from a place of how do I know if it's really important for me, or is it possible that someone could be placing more weight on that than there actually is for them, or might not, or it was a blind spot for them and they didn't realize it till they were in treatment? Is that kind of the two areas you're going with right now?
Yeah, I feel like there are different, especially as someone totally new to therapy, I feel like it could play out in a couple of different ways. Like I could maybe, search really hard and wait a long time to find who I think is going to be the sort of demographically perfect provider. And then find like, oh, actually, I come to therapy worried that like, I'll be triggering issues in them or something because we're from too similar a background, right? Or conversely, I could, sign up with someone through Psychology Today who maybe doesn't have any of my same attributes and then feel like I can't really make them understand or connect with them about some things around race.
Okay, and I got that. So I love that question because I think it's so great. And this is, there's kind of two areas that this can go in. I think that as a therapist who does get chosen at times because of the fact that I am part of the API community, I'm a clinician of color, there is often a desire to kind of come into the space and say, I'm looking at you and I feel like I can relate to you in some way. Now, my job is not to necessarily share my story to become more relatable. My job is to hold space in that room for what your story may or may not be, and the fact that there's a desire to have us connect in that way and utilize that to kind of create room in the treatment for us to guide it. Now, if something triggering is coming up, I would imagine that's something much more clinical to look at in terms of an identification in the space and a clinical reason that something is getting triggered by it. Now, when we're talking about it there, I'm going to kind of go in the direction of when we're talking about a therapist that does not look like someone that we can identify with and does not look like someone who can understand our story. What we're really talking about is, does my therapist have cultural competency to work with me? Right. And that's a question that can be asked to any therapist that you may or may not know if they have an understanding on what your history or what your story may look like. And that may be bringing up something in the room or with that therapist in the consultation and saying, while I may have been initially looking for a therapist in the AAPI community, I also want to have the option to work with someone else. I'm just curious, do you have a cultural competency when it comes to X, Y, or Z? because it's absolutely fair to say, I don't want to have to educate my therapist on my background while I'm in treatment. Now, as a therapist who can acknowledge I don't know about every culture, there are times things will come in the room and I will have to say, you know, I'm really curious, is that a cultural connection that you're sharing with me right now? Is that a cultural experience? And I might use that kind of as an understanding to understand this person a bit more, but at the same time, I'm not going to ask them to go into the history of it either, right? So we really want to know that our therapist we're hoping for cultural competency, even if they look just like us. The reality is our fantasy is that they hold the same narrative as us, right? But the reality is they may or may not, and it's not their job. It's actually ideally not something they do, is sharing their story with you, right? Because we want to be, this is where I say it's not a friend. It's not someone who's there to relate to you in that way. It's someone who you are choosing to relate with and feeling safe enough in the space to open up with. So I'm going to keep highlighting that word, cultural competency, because it's so, so important to feel like our therapist has the cultural competency to work with us, right? And doesn't make assumptions about us either, right? Because we may look a certain way, but they may or may not know where we were raised, where we grew up. And that's also really important too, in terms of how we became who we are, right? First generation or second generation. So it's so important to know that there's so many more layers behind that appearance. But I do think that there is currently a draw and a desire to find therapists that we can identify with, that we can look at and say, I see a part of me in you. And that, just knowing that that exists brings me into this space right now, right? And there's a value to that. And I can acknowledge that there's just not enough therapists in the AAPI community, right? There's many psychiatrists, but not enough therapists. And that could probably speak to your earlier statistic, Amber, of, you know, the lack of willingness to go into therapy is also kind of the lack of awareness probably for many clinicians who wanted to go into this field, but didn't know if they could. Right. So those are kind of some areas to think about. And I almost feel like I'm talking about things that you may not actually feel connected to in tonight's conversation until you start to do them. And when you make that first call, you kind of go, okay, I understand what Sweta meant, you know, in that conversation. Or when you sit in the room for that first time, I tell everyone, set up 2 to 3 15-minute consultations. Most therapists offer them for free. If that therapist doesn't, and you're really ambivalent about whether or not you want to do this work, maybe don't start there, because you really want that opportunity to just say, how did it feel on the phone? Because most likely how it felt on the phone is a version of how it's going to feel in person for you, right? And you want to feel like that therapist had the ability to meet you where you were in that moment and have some level of understanding of what you're calling for by naming it with you. Even if you didn't know when you first made that call, right? You want to feel a little bit more aware at the end of it.
Yeah, thank you. So can I let you talk about how that first call might go, and then how that first introductory chat might go?
Absolutely, absolutely. So that's kind of the area I was going to move into now. So, I kind of said, you got a few therapists to call. What do I ask them? And how do I know if we're a good fit? So you're going to share a bit about what's bringing you into therapy at this time. And, usually I kind of start with, I'm curious about this call right now and kind of what's coming up for you as we're speaking today. And usually that person will tell me, X, Y, or Z recently occurred, or I've for a while now, I've had trouble sleeping. I'm just noticing that I have these racing thoughts at night. I can't really name them, but I know a lot's coming up. And all of my typical, resources that I use, the gym, eating well, my partner, they're just not feeling like enough. So I need to talk a little bit more, I think, with someone else, or my friends have told me I should talk with someone else. And most likely what I'll do in that moment is I'll reflect back to you what you shared with me, and I'll acknowledge that it sounds like, again, you're having trouble sleeping, that everything you've kind of been able to rely on isn't there for you at this time, or isn't there in the way that you need it to be. I'm curious kind of what thoughts you're noticing are coming up before bed, or I'm curious, when your heart's racing, are you kind of aware of what's going on in that moment? Most likely, you'll be able to pause in that moment and say, yeah, I'm a little anxious. My kid's starting school this year, or it's been really hard. I've been really worried about what's been going on. And the crime, the AAPI crimes and the Asian hate, and I commute into the city, just feeling really triggered by it all. And I'm kind of scared to go to work right now. I feel like I need to talk to somebody to be able to get back there. And we're just going to notice the symptoms that you're describing. I'll describe a little bit to you in terms of how I work and what my intentions are in the work. What I typically say to most clients is that I encourage a weekly model of treatment. We try to meet once a week, ideally at the same time. And I ask usually for a 3-month commitment in that work, because I find that anything less than that is really hard to kind of support the clinical needs. Now, of course, I understand that sometimes financially or time-wise, there can be a barrier in that, and we can definitely talk about that and how to address and support it. But those are my initial intentions. I do that to really guide my clients or potential clients kind of on how I work clinically, and to really encourage them to know that they're working with a therapist who is in the driver's seat, and can guide them in the process, so they don't feel like this is one more area that they have to decision make on and drive in. And I think it's important to feel like you have confidence in the therapist that you're working with. At that point, I would encourage you to go, how do I feel right now? How am I feeling on the phone with this person? Check in with your body, and somatic work is really important right now. Somatic work is all about, what is my body telling me? Is my heart racing right now? Do my palms feel sweaty? Did I feel a sense of relief when she just repeated back to me the things that I shared with her? What did I feel as she was talking to me? And really pay attention to that and notice, did I feel a sense of comfort? Did it feel a little bit off? And maybe she was nice, but I'm kind of curious about what else is out there. You might continue the phone call, or most likely I would continue the phone call and just kind of give them a sense of those things. And the next question is, or that I'll mention on my own, is, what the cost of my services are. Typically I'll share that right away. And then you may or may not go, wow, I don't know that I can continue to do that, or I have to check my out-of-network benefits, or, hey, I think that I want to go in network. Can you give me some guidance on that? And at that point, I might say to you, yeah, share with me what your insurance is, and I'm happy to, jump on my listserv for you. If we're going to continue the conversation, I might, ask you a little bit more about, what are your goals, you think, in treatment at this time? Have you worked with a therapist before? What worked for you? What didn't feel like a good fit for you? Just to really get curious about what you're looking for in the work, and help you identify it and put some words to it, so that you know what you're looking for in this phone call as well. I would ask the therapist, in the conversation. I'm a therapist who pretty quickly talks about what my frequency, session frequency intentions are. But I would ask you, to say to the therapist, do you have weekly treatment? Are you okay with kind of more of a check-in? Are you a therapist who's open to seeing me every other week? You can ask them what treatment models they work with. I don't know how helpful that is for you unless you know what you're looking for. So I don't know that it's as important that you ask that question as it is that you identify what is going on for you during the call, and then maybe ask them, what they might do in terms of a treatment model to support it. If they answer that question and the answer feels a little confusing to you, I encourage you to just ask more, because that therapist can continue to kind of educate you on what you're looking for. In terms of the actual work, every therapist is so different, like any other work that we do and with the service provider. So I would say no two work the same. But know if you want a therapist who's a bit more active, or know if you want a therapist who kind of is not someone who will lead the treatment and kind of allow you to lead it more. Every therapist will kind of tell you who they are. I've had some clients say to me, I really want a therapist who will talk more and guide me more. One of the words I always hear as a therapist is, I want more tools. I want to fill my tool bag. And there'll be therapists who are happy to do that, who are happy to give you homework in between. I'm not someone who really does that. So if you know you're someone who's going to do great with that, tell that person on the phone in the consultation, and they'll tell you if they work like that or not. And if they don't, most likely they'll refer you to someone who does. But knowing that about yourself is really going to help you get closer to who's a right fit for you. In terms of group practice, like I said earlier, most likely if you do choose a group practice, and those practices are the ones that often will take insurance, there'll be an intake coordinator. Most likely that intake coordinator will understand a little bit more of your history, so you won't get to talk directly to the therapist you're working with, but they will understand kind of what your needs are. They're usually trained to be able to parse that out in the phone call. And then they'll be able to, connect you to a therapist in their practice who has that specialty. And most likely on their webpage, they'll have some bios on all of their therapists. So you can read up on that person, and you can also say, does this person feel like a right fit or not? But I always say, if you get paired up and you have the opportunity to work with somebody, it's hard to always know in the first session, unless you completely walk out and say, I don't want to go back to that person. Sometimes it can take a couple sessions to feel like you're building some momentum in the space and able to feel like, okay, I'm in a place where the work is gonna, be what I need right now. But I'm in our in-person meeting, we did a little bit of a role-playing call just to give you a sense of what it can look like. And I just think it's really important to remember it's a conversation just like any other. There's no wrong questions. It can feel really overwhelming and really hard the first time you make that call. But it's a big deal when you do, and when you get on the phone with that person, if you feel a connection, it can really provide you relief. And so I encourage you to do it. And I encourage you to do it a couple times to give it a try and get closer and closer to the right person for you. Sometimes it's the first one, and that's always an exciting time. But that's kind of, what I have for tonight in getting connected to a provider. I would love to answer any questions that you might have. I know I went in a lot of different directions, but I'm curious if there's any questions out there in the community for what might be needed, or areas that you feel like weren't touched upon tonight that I could specifically answer for you.
Thank you, Sweta. So yes, please feel free to unmute or drop your question in the chat. In the meantime, I'd love to ask about searching for provider for someone else, for like your child, your adolescent. Are you the one on the phone usually with the potential provider talking through your child's needs? And then what is communication like after that? Like, how do you know what the fit is if you're not like in the session?
Yeah. So, if it's for your child, typically anyone kind of under that teenager range. Most teenagers, if they're going to therapy, they don't really want their parents involved very much outside of getting them connected. I will say that, most likely you'll be on the phone with the therapist and trying to connect them after the first appointment. If it's a teen, most likely that whatever is in the room is going to stay in the room with that clinician, outside of any intention to harm self or anyone else. That clinician is really, has to keep everything confidential, and we reinforce that for anyone coming into the space. That being said, if it's for a younger child, typically the therapist will do what's called, collateral sessions with the parent. So they'll meet with on the phone, they will speak to the parent about what the presenting problem is, what the needs are, see most likely the parent first, and then they'll meet with the child. And then ongoing from there, they'll typically meet with the child alone. That being, and then from that point on, if there's any additional needs, there's either family sessions or there's what's called collateral sessions where the parents will get to meet with them individually outside of the child sessions. If it's, again, like I said, a teenager, most likely everything that's coming up in those sessions is going to be confidential, and that therapist is not going to want to break confidentiality, because that could really break trust in this space. So it really depends on the age. But I will say, most likely the parent's always making the first call, teenager included, to get them connected and to get them to their first appointment. If it's for your spouse, most likely that therapist will, or any other adult who's capable of calling, that therapist will probably say to you, hey, I'd really love it if your spouse could reach out to me directly, and I'd love to speak to them. I can't really create an appointment for them until I speak to them. So we really try to encourage everyone to kind of do that on their own.
Thank you. That makes sense.
Absolutely.
Can I read a question from the chat?
Absolutely.
Are there psychiatrists that prescribe medicine and do talk therapy? Or is it better to have a separate psychiatrist for medicine and a therapist for talk therapy?
Yes, there are psychiatrists that do talk therapy. There's actually a handful of them in town who are wonderful. I would say there's absolutely nothing wrong with seeing your psychiatrist also as your primary therapist. The only difference that I will say you're probably going to see is cost, because a psychiatrist, even if they're not prescribing during session, is still going to be more cost per an hour, just because of, the licensure that they have. But outside of that, there would be absolutely no reason that you couldn't, if you're meeting with a psychiatrist who provides talk therapy as well. And yes, it's out there and it exists, and there's nothing wrong with it if you choose to do it, if you kind of choose to keep it all in one place. I think that in that arena, what I want to answer is that, the question always becomes, I can see a psychiatrist, or I can see an LCSW, or I can see an LPC, or there is all these letters. We all have letters, right? No one really knows or there's a psychologist. No one really knows what the difference is in who they're seeing, because we're all mental health providers at the end of the day, outside of a psychiatrist who can prescribe medication, of course. What I will say to that answer is that typically everybody's kind of trained differently. In my experience, and none of this is, based on concrete data that I have written in front of me, a lot of psychiatrists, they primarily focus on medications. Some will do additional training on psychotherapy and how to provide psychotherapy and treatment. And then they'll have a little bit more of an expertise in that area. If they are a psychologist, what I find, of course, there are psychologists who are in private practice, but a lot of psychologists, you'll notice, do a lot of testing. They tend to fall more into that arena. So you might notice someone who's doing more kind of neuro testing or ADHD testing, kind of different arenas of testing, tend to be more psychologists, because they are trained and capable of doing that. So you'll notice PhD after a lot of, people who are in the testing environment. I'm an LCSW, so I'm a clinical social worker. So essentially what that means is my training, comes from a social work background. Social workers tend to really focus on like the person in their environment. That tends to be our specialty. And so I'm always kind of looking at how your environment is impacting your system and kind of trying to make space for that as well. There's people who are MFTs, which is, I don't know all the letters, but marriage and family therapy. So that's their expertise, right? They went to school specifically for that. And there's a bunch of, the LPCs, I'm apologizing to them. I have no idea what their expertise is in, but they are also in mental health. It's really what niche that person has chosen once they've come into the field is what they're most attracted to and what they're going to work with. So I myself am very interested in perinatal and couples. I am constantly in training for those things. So you're really going to, the letters can matter, but what really matters is, what are you doing to kind of continue in this field and stay on top of what's out there with it, so that you can bring that information to me and help me identify it in the room, right? Because I always kind of say I'm kind of a vessel for information too. And I'm in the areas of like, you don't know what you don't know. And it's my job to bring that information to you and identify it with you and for you in the room, so that you're not finding yourself kind of running in circles, not knowing what you're looking for.
Thank you. Another question from the chat. How does a culturally competent therapist balance a patient's unique / individual background versus the collective or cultural relevance that everyone in a certain community may experience, for example, first gen?
I need to see that question.
If you open up your chat, you can.
I'm going to do it. I will acknowledge for myself, I'm a very visual person, so I tend to need to read more than, which is interesting in the field that I'm in, right? Because no one's having me read their experience. Let me read this. Patience. Okay. So the way that I'm kind of, this question's landing for me, how does a culturally balance? Is kind of meeting that person exactly where they are. That is my intention as a culturally competent therapist, is that the first time that person calls or comes into the room or I meet on the screen, I cannot make any assumptions about what your experience is. All I can do is listen, repeat back, and really try to identify what you're bringing into the space and try to guide based on that, while also understanding that there might be things in the conversation that you are saying to me that are connecting me to be able to say, this is something that I understand through my expertise that often comes up for those who are first generation, or for those who are, coming from households where mental health can often be dismissed or spoken negatively about. And I might at that point really be able to reflect back and connect to that experience without, again, assuming that that's what yours is. So it's really the therapist's job to slow down in the space and know that the person that they're meeting with has their own story. And they're coming in to talk about their own story. And again, I can bring some of the collective experience in. I can bring in some of what's been going on, kind of in our world that's been really scary and really triggering in the community, and acknowledge it as part of the experience if it feels appropriate to do so. And that can only be appropriate if that's something that that person is bringing in to me, right? So it's again, it's so much of slowing down and intention and clinically kind of guiding the experience, which I wish I could say there was a format of doing that I could clearly explain. But I think at this point, I've understood that the process itself kind of works so quickly in a therapist's mind. But for the client, the hope is that the experience is that they felt that their clinician slowed down with them. Right. I feel like that answer might have been everywhere. I also think that, part of coming into the room sometimes can feel like it's everywhere, right? And I can mirror that back sometimes.
No, I definitely sympathize with this sort of concern that, like, you want someone who is culturally competent, but you don't want them to be sort of assuming things about you or projecting things onto you that you are not necessarily bringing into the room,
Absolutely.
So but it sounds like a good practitioner will be meeting you where you are and looking at you as an individual versus jumping to conclusions about your experience.
Absolutely. And I want to say, it is my work to acknowledge that what I look like in the room matters, what that can impact maybe why you chose me. And instead of my need to factually tell you about my story, I can get curious with you about what about me you thought you needed to see, right? Or what about this experience you thought was going to really connect to you? Because that gives me tools to understand you more and understand what you're longing for in this space. And I think that, the underlying goal for any therapist is to not make any assumptions, to not advise, and to kind of look at our patients as coming in with a blank slate, and they're going to kind of color all over it. And we just have to see and watch over and see what they're coloring and understand it with them. Right.
Thank you. I'm going to read the next one, but feel free to read along with me.
Yeah, thank you.
If someone were to opt for telehealth, does the provider need to be in New Jersey, or could they be anywhere in the US? So would they need to be in the same state?
Yeah, absolutely. So it really depends. There's all of these new companies out there. I think there's Alma and BetterHelp. There's kind of these bigger companies that exist now that are kind of nationally licensed. It's confusing and I don't fully understand it. But because they're this large group practice that works nationwide, because they're ran by a corporation, they are able to hire clinicians who I think live anywhere and can work with anybody in any state because that large organization has licensed themselves in every state. If we are private practice clinicians like myself or a lot of people you'll find on Psychology Today, we can only see people that live in states we are licensed in. So I am licensed in New Jersey and New York. No states offer reciprocity. Some states offered something limited during the pandemic, but that's completely gone now. So your clinician really has to be licensed in New Jersey, and it's rare to find a clinician who lives outside of New Jersey who's licensed here. Because licensure is, of course, something we have to maintain, we have to pay for, we have to continue to get CEUs for. So you really probably are going to be limited to somebody within the state of New Jersey, unless you go to one of those larger corporations and you find somebody through there. One of the drawbacks, one of the attractive features of those is that there's so many options and you can get connected pretty quickly. And I think you can read bios on there. What I'm often informed about those places that unfortunately their retainment can be a little bit lower and you can't typically find that provider. So if, let's say that they decide, to leave one of those larger corporations, you're not going to know where they are after. And now you've kind of developed this relationship with this provider and now you don't have any access to them. So that's the only drawback I've really been told when you're working with a corporation versus a private practice provider. But if you are going to stay with telehealth, yeah, you can look anywhere on Psychology Today for the state of New Jersey providers, but you really can't go outside of there. Licensure is a little bit of a pain. It makes, there's a lot of complaints about it, and there's a lot of hope to get the ability to kind of serve anywhere, because of course we have clients who move, or we have, there's always that conversation about kids going off to college and having to find a new provider where they live and then come back and have another, so there's not a continuity of care. So there's a lot of complaints about that issue, but it really hasn't been resolved, unfortunately, in this mental health world yet.
Do you have thoughts on the effectiveness of those apps like BetterHealth and Alma?
I think at the end of the day, as a private practice clinician, I'm always going to be biased, and I probably shouldn't be the person to answer it honestly. I just don't know, I'm going to question, when you have a business running something that's mental health related, I just don't know who's sitting on the top of that table to really make the decisions for the trainings that those people have to get, what specialties they actually offer versus what specialties they could say they offer. So I don't know how much due diligence is being done for the clinicians that you have access to. And on the other end, I'm going to say you probably can find a great clinician on there. I just have no idea what really occurs kind of behind the scenes. And because I know retainment is lower on those arenas, I'm assuming that just knowing that you can't always find access to that person just makes it a bit unattractive to me. They exist and there's so many of them. I'm not a clinician who's done enough research on them to speak, enough about them to say too much. But most clinicians in private practice don't have the best feelings about them existing, because it's kind of taking mental health, again, back to the business model instead of the service model.
Right.
But they're out there for a reason. There was obviously a need if they exist.
Sure. Can I just ask one more question? And if anyone else has other questions, please be sure to drop them in the chat or raise your hand, and I think I'll be able to unmute you. What are the signs that you have found the right fit versus signs that maybe you should move on? And will a provider help steer you as well if they feel like it's not working out?
Yeah, I think the signs that you have found the right fit, I will reflect back what I hear when it's a right fit, as my tool tonight. There's relief when you come into the space. There's a feeling of being seen, heard, respected. There's a sense of confidence in the room that your therapist has an understanding and an expertise in what you're looking for. And you feel that confidence when you're in the space with them. And there is a desire to go back, right? When you come to that first appointment or you have that first phone call and you say, not only did I feel relief after talking to you or coming in that first time, but I was really looking forward to coming back. Then that's a sense that you're getting, that you may have found the person to work with. And in the opposite, if you're feeling ambivalent, I often say, trust your gut. It's attunement, right? It's trusting our own voice. And this is such an important place to trust your own voice. You don't want to just make it fit. We don't want to force it. Because if we do, what happens is we're not going to get to feel safe in this space and we're not going to open up in the way we intended. And we're going to do what we're doing in the outside world, which is guarding this part of ourselves that we came in to open up and to understand more. And if you find yourself doing that in this space with your therapist, it's not the right space for you because you're limiting the work that you can do. And ultimately, they're not going to offer you, what you need because they don't know you need it, right? Because you're kind of keeping that part of yourself outside of the room. And so I think that in itself would kind of tell you it's not a good fit. Does that kind of feel like it gets close to the answer?
Yes, thank you. That's helpful.
Yeah.
Shall I share the resources that you compiled for us?
Absolutely. Absolutely. Yeah. I think it would be useful for everyone to kind of get to see those. We have that mental health resource list that was put together, and we're going to continue to expand it. Our hope is to continue to create, services in the community as well, the local community that really speak to the AAPI community needs. But this is kind of a starting point based on tonight's conversation. You'll notice that, it's just kind of a list of things that we talked about. Some resources of where to find a therapist, Psychology Today and ZocDoc are on there. That out-of-network guide, it's a little long, but it really gives you all of the how-tos. And then just a quick, article on how to find a potential therapist and questions to ask them. So you feel like you have a starting point and a little bit of a script to use. Sometimes we need someone else's words before we can find our own. So it's a good place to start and not have to reinvent the wheel for yourself. And then here is the list of South Asian American therapists that we have. We were able to compile this through our local listserv. We have a couple therapists that were able to respond to us and let us know that they're part of the community and they have availability. And so you can outreach to them. We are hoping to kind of create something that maybe we can offer, in the community that is more visible and accessible to everybody and get you closer to the mental health services that you're looking for. And, as I mentioned in the last workshop and again tonight, I'm always a resource in the community. If you ever kind of just have a question or don't know where to start, I'm always open to you outreaching to me via email and just becoming that starting point for you to get started and see what you need. So any questions that you might feel like you have, this is a list of kind of lower fee services that exist out there or places that take insurance. Now, just a reminder, sometimes, you're going to work a little bit harder to get through, but I encourage you to do it and make those phone calls. You can see that some of them kind of identify if there's a specialty there, what it is. And then sliding scale, I know I didn't talk about that earlier, and I'll just kind of make a mention to it. Sliding scale is essentially either in these places, they might say to you, you have to provide us pay stubs and kind of an awareness of how much you're making so we can tell you where you fall on the scale. In a lot of private practice, not everyone will ask you for that. Every therapist that I know, myself included, will hold a handful of sliding scale spots that we kind of range on our own and offer them out to clients so that there's always kind of an access to services in their practice. So you can always ask a therapist when you speak to them if they do have If they're not a network provider, do they offer sliding scale, and do they have any slots available, and what would that rate look like? And they'll be able to tell you that. Or you can always say, if something opens up, could you put me on a wait list? Some therapists will do it, some won't. But it's always worth asking the question, because you never know what the answer will be if it's someone that you think you want to try to work with. And you can see the link for the resources. So all of those are on that URL that you can see. And it looks like, I think Amber said they'll be on the AAPI page soon as well, so that there'll be kind of one home for everything.
Yes, and we'll also email these links to our participants tonight.
Awesome.
Hey. Thank you, everyone.
Awesome. Thank you. Perfect. It looks like that was the questions. Is there anything else that feels like it's lingering or kind of pressing at this point? It doesn't look like it. I feel like there's so much more we could talk about. You're welcome. I'm so glad that everyone was able to get on tonight. I know, saying to Amber earlier, I know it's late. I know it's the week before school starts. It's the end of summer. There's so many reasons we could have said I'm not going to come on. And you're here and you're listening. And I hope that this, you'll have access to this recording later if you have any questions, or if there's something that I said that you just need repeated. I know I repeat myself a lot anyway, so you can hear it here again. And please, please, please outreach if there's something I can support you with in the community, or you just want to speak about it more privately or directly. I'm happy to kind of hear from you.
Thank you, Sweta. The good news is we're not letting Sweta go anywhere, so she's going to be around.
Absolutely not. I am here to support AAPI and a mental health initiative and be a large part of that umbrella, so that we can continue to figure out what we need in our community and offer it, and continue to be a voice for mental health and a voice in a discussion maybe that we're not having, but we want to have much more and get a little bit louder with it. So I look forward to doing that. And Amber, thank you so much for creating a forum to do this and to host this. This was absolutely wonderful. I didn't know what it would look like to talk with myself tonight, but it was great.
All right. Thank you so much. Thank you, everyone. Good night.
Thank you, everyone. Have a great night.